people have gone to healthcare providers in the past and not felt listened to, and not felt like their problems were taken seriously. We know that historically, even like medical students was taught that Black people didn't feel pain in the same way that white people did. And so there's a lot to unpack here around kind of why we ended up in the situation we did in COVID and why this is an ongoing problem. But I think we're at a point now where we're having these conversations, and we have people like myself, a lot of people like myself, a lot of people both within and outside of the healthcare, the NHS itself, who are willing to have these conversations and want to have these conversations and want to ensure that we give people equal and fair access to healthcare, to ensure that people are well informed and that they feel like they can come to us if they have a problem.
Affinity Xtra. Be extra.
The views and opinions expressed in this podcast are personal and do not necessarily represent the views of Affinity Xtra.
Hey guys, it's Roger here from Affinity Xtra, celebrating gospel music of Black origin. I'm here on my show, The Edge, in partnership with the NHS. We're going into some subjects with health and Black and just the Black... I would say the issues that we have within our community, what we've been thinking, not only about COVID, but we're doing that one today, but also there's other issues, diabetes and so on. And so we're going to have some professionals. So yeah, we have some professionals who are coming from a professional perspective to help us make informed decisions about our health, which is our wealth, guys. You know, I'm always encouraging that, and I want us to make informed decisions, not based upon emotional or people sounding like they know what they're talking about, but from people that know what they're talking about. And you know what? The people actually look like us. Oh, you know what I mean by that anyway. So yeah, but are we here today? You would have hopefully seen another video just before this, but I am just going to introduce the doctor that we have. I'm so proud. You know what I'm saying? Another Dr. Sarah Ann Filson. She is here with me today. First, you think doctors are your GP. But sorry, I'm learning that there's a lot more than just a GP here.
Hi, everybody. Really great to be here. And thank you for listening or watching. So my name is Sarah Ann Filson, and I am an infectious diseases and microbiology doctor. And I work in a Northwest London hospital. I've been heavily involved in both the COVID frontline response, so working on the wards, treating patients, but also in community engagement. So talking to people who look like me, our communities, about COVID, what it is, what the signs are, about vaccination, how we can get ourselves vaccinated, how we can keep ourselves safe, but also about long COVID, just raising awareness about the importance of understanding what long COVID is and how you can get help and when you should get help as well.
Your specialist definitely in microbiology. I interviewed Martin. Anyone wants to check that interview out, please do. And I almost fainted. I needed to sit down and have a herbal tea after that, just to settle the system down, because somebody gave a survivor's account of COVID. When I'm saying survivor, sometimes we think survivors is fully recovered and everything's normal again. It sounds like that experiment. You just have to manage with what you almost have and then move forward with where you're at. He got very badly sick and it's taken 1.5 years just to get back into work. So it's very, very serious. So obviously you know his story.
Yeah, so I mean, I've met Martin. He's a great guy, and also met some of his family members. Unfortunately, Martin's story isn't necessarily an unusual story. It's not something that, I mean, prior to COVID, it would be something that I wouldn't necessarily expect to see. But unfortunately, during COVID, myself and many of my colleagues did see too many people hospitalized. We saw a lot of people who looked like you and I. We saw a lot of people from ethnic minority communities who previously had been relatively fit and healthy, who ended up in hospital severely unwell with COVID. I'm sure we know, unfortunately, many people didn't make it, but also there are many people who went through very similar experiences to what Martin went through and are still rehabbing from that experience. Spending a long time in a hospital for any reason can leave you with a lot of ongoing health problems, but especially spending time in an ICU environment, having such significant disease, having complications related to that disease can definitely lead to long-term problems and need a lot of rehab. And one of the things we know about COVID is, unfortunately, it did disproportionately affect people from ethnic minority backgrounds, especially people from the Black and Asian communities. And we saw that actually the death rates were highest within the Bangladeshi and Pakistani community, but also were very high within the Black Caribbean and Black African communities as well. And so this is something that we are working to understand. We know it's related to inequalities. We know it's related to multiple things in relation to the way in which we interact with healthcare, but also our lives within this country as a people and as a community. And I think there's a lot that can be unpacked from what has happened in COVID.
No, you're 100% right. After 1 week, it was Black people can't catch the disease. And then the next week, oh my goodness, they made it out to be like genetics, and it became you're inferior, but you're more likely to catch it because you're Black. And I'm thinking, it's not as straightforward as because I'm Black. Maybe it's a case of what job I do. Maybe it's a case of what environment I'm. Do I have to go into work? What does furlough look like to me? There's so many other situations on it. Also, when's the last time I've been to the doctor? It's okay saying I'm healthy, but when you got men who are 55 said proud to say that I ain't been to the doctor for 25 years, you got some answers in COVID, how your body responded to it. I see you nodding your head. I don't want to be the typical proud Black man in the 50s going around, I ain't seen a doctor for 30 years. And then all of a sudden, bam, they're gone. Because they just never had checkups. I don't know, would you say that was a bit of a problem within our community?
I think definitely. I think one of the things we're trying to do a lot is trying to engage more people in health. And I think it's one of the things that we hope that COVID will have highlighted, that you can't ignore your health. You need to have regular checkups. If you have a pain somewhere, if you're feeling unwell in any way, you need to seek help, and you need to ensure that you are actually as fit and healthy as you think you are, because I think there are a lot of people who have undiagnosed what we call comorbidities, things like diabetes, things like high blood pressure, things like even problems with their breathing. So COPD is one of the things we talk about a lot as well. And I think there are multiple things that people unfortunately ignore. And all of us have very busy lives. We're all very busy. We prioritize things like, for example, looking after our families, ensuring that we're going to work every day. Within the Black community, we know we've got this whole thing around Black men being the provider for the family. And there's a lot that comes with that. And often that means that they feel that they can't spend the time to go and look after themselves or to make an appointment with the GP. And so that's definitely something I hope will change. And I hope that as healthcare workers, we can continue to engage with the community and get people to feel more comfortable to come to see us. Also, another thing to say is that we know that people have gone to healthcare providers in the past and not felt listened to and not felt like their problems were taken seriously. We know that historically, even like medical students was taught that Black people didn't feel pain in the same way that white people did. And so there's a lot to unpack here around kind of why we ended up in the situation we did in COVID and why this is an ongoing problem. But I think we're at a point now where we're having these conversations, and we have people, a lot of people like myself, a lot of people both within and outside of the healthcare, the NHS itself, who are willing to have these conversations and want to have these conversations and want to ensure that we give people equal and fair access to healthcare, to ensure that people are well informed and that they feel like they can come to us if they have a problem. So the majority of people who get COVID will essentially recover within a couple of weeks. They will feel fully recovered within up to about 12 weeks and will be fine. However, there is a proportion of people, and unfortunately it's a growing proportion of people, who may have ongoing symptoms. And these symptoms can be anything from, for example, feeling fatigued, ongoing cough, ongoing shortness of breath, problems with sleep, problems with concentration. There's a massive range of symptoms that people can get with long COVID. And a lot of people actually don't even realize that that's what they've got. So they've had COVID, they still don't feel right a couple of weeks later, and they're just like, oh, I must just be tired, or I must just be stressed. They don't understand that actually a lot of these things can be related to COVID.
Wow.
And one of the things we as kind of health professionals and within kind of clinical medicine are starting to understand is we're starting to realize more and more that there are more people who are affected by this. And we're starting to work on ways in which we can help people both symptomatically, but also that we can rule out that there isn't anything more severe going on. That's the other thing. So there's kind of a twofold reason why we want people to want to know about long COVID is because we want people, if they have symptoms, to come forward to get help, or even to use self-help. There's a website called Your COVID Recovery that goes into some of the symptoms, etc., and can help you manage some of your symptoms by yourself.
That's brilliant.
But if you feel that you can't get help by yourself, there's your general practitioners, community health organizations that can also help with symptoms. And then actually, if all of that is if you're seen by your GP, if various tests, etc., are done, and actually they think that you need more specialist help, thankfully, there are now long COVID clinics. There are specialist units that have been set up around the country. Importantly, they've been funded. That's really important. You can't just spring up a clinic without having funding to it. And
wow, that's good.
So I think it's really important that people start to be more aware of the fact that COVID isn't just about the acute illness. It's not just about the people in hospital. It's not just about the deaths, but it's also about the ongoing almost disability or ongoing rehab that people may need. We heard about Martin's story, and somebody who's had that kind of experience will definitely, for understandable reasons, have long-term rehab problems, rehab goals. But there are also a lot of people who have had mild COVID who won't have had any interaction with the healthcare service whilst they had their COVID, who may still need it. And I think that's important to note, and something that we need to ensure that our communities know about. In the same way we said, we want people to get checked up if they're feeling certain ways. We want people to have their blood pressure checked. We want them to get their diabetes reviewed. All of these types of things are things that we need to encourage more and more. And I hope that COVID will be a gateway
two steps
in order to increase that.
Oh no, absolutely fine. Yes, the reason why we probably don't go to the doctor because you never listened to a 2015 and we got sick, and we hear sad stories about our auntie, our uncles, and so on. And I appreciate a lot of this conversation that we're having in NHS. They're not going, we ain't done nothing wrong. They're saying, okay, there's been issues, but we need to move forward because people are dying. We're not trying to delete the past, but we got to move forward. So let's look at a better way forward for our communities. And as you said, we're utilizing COVID for a springboard for better practices. Unfortunately, extreme situations help sometimes us to get better. I always said, sounds sad, but war leads to a lot of inventions that we use today. How we preserve food and whatever is because they want to feed the shoulders and keep food much longer. So there's a lot of things that evolve thanks to really bad circumstances, and COVID has been a bad circumstance, and improving healthcare and awareness. Okay, I look at flu as an old people's disease. If I catch it, I'll sniffle it out. I can handle it. But in COVID now, at first it said it only affects the elderly, and when it moved down to it doesn't affect children, and then it only affects certain ages and so on. We're going into winter. Who does COVID actually effect, and even the flu itself? Is it a problem for everybody to be aware of? Because there is a lot of kickback with vaccinating teenagers, a lot of kickback with vaccinating, not say ultimately think they're healthy. There's a lot of, oh no, I'm right, you're wrong, or whatever. What is the official word on this?
I think that's a really good question. I'm glad you brought up flu as well, because I think it's an important thing to talk about, especially this year, because I think unfortunately we're going to have a bad flu season. One of the ways we know what flu is going to be like in this country in our winter is we look at the winter that Australia has had. And what we know from kind of Southern Hemisphere and Australia, etc., in relation to their flu this year is that they had a very severe earlier flu season than they would do normally with quite bad flu. And I think that's something to bear in mind when we think about we're going into this winter. So, I mean, the reality of the situation, and we've all seen it, is that COVID can affect anybody and has affected multiple people.
Yeah.
In different ways. There's still work going on to work out exactly why, for example, some people get more severe COVID than others, even though they otherwise seem very healthy. But one of the things that we do know, and one of the things that's been proven through data now, is that actually vaccination reduces your risk of severe COVID. It reduces your risk of being hospitalized for COVID. It reduces your risk of dying from COVID. And actually, it also reduces your risk of long COVID. I think that's very important when we talk about younger people, because unfortunately, one of the things we are seeing now is we're seeing, or at least we're hearing about across the world, but also within this country, is about the tsunami of people who actually have ongoing long COVID,
long COVID issues,
symptoms related to COVID, regardless of whether or not their infection was initially very severe or whether or not their initial infection was mild. There doesn't appear to be a differentiation between who gets long COVID following COVID, unfortunately. And so we know that vaccination is really important and can protect you from severe disease. We also know that it doesn't 100% stop you from getting the infection. I think that's something we need to be very honest about as well. Because I think people were very much like, well, you told us one thing and then you told us something else. And I think that's something that we should also talk about in relation to the pandemic as a whole, because what we did see is we saw the unraveling of a global pandemic.
Yeah.
And the thing about this is it was a novel infection, a novel disease, and we learned as we went along. And that meant that, yes, the messaging did change and the communication did change, and the way in which we have dealt with the infection has changed as well. There are a lot of people who say, should we have locked down earlier? Should we have locked down later? Should we have locked down at all? I mean, I think we did what we felt we needed to do at the time with the information that we had.
Brilliant.
But as information has evolved, as the infection itself has evolved, as things have changed, we've adapted the way in which we manage this. And we're now at a stage where we know that COVID is still around. We know it's still a problem. We know it will be a problem this winter, not just for elderly people, not just for people with comorbidities, but for all of us.
Yeah.
It will affect different people in different ways, but we know that COVID will be a problem for us all. And we need to be realistic about that and do what we can to protect ourselves. So I always talk about the importance of vaccination. I also talk about the importance of, if you're in crowded areas, thinking about wearing a mask, ensuring that you're just keeping up with your hand hygiene. All of these types of things, I think, are obviously a personal choice. Yeah. And I think that's important as well, because I think, many people had problems with things like mask mandates, etc., which we can talk about. I don't want to talk about. We can go on for ages. But I think it's also important to note that we, as individuals and as communities, can make informed choices that are right for ourselves. If we know that we have a risk of something, we should be doing everything we can to protect ourselves. And that's why I think it's so important for professionals like me to be available to have these conversations with people and help people make the right informed choices with the right information. There is a lot of information out there. A lot of it is rubbish, unfortunately.
Wow.
A lot of it.
You just said it crude like that. Rubbish.
I'm just being honest. I mean, we're here to be 100% authentic.
100%, man. Yeah.
100% authentic today, right?
Yeah.
So we're keeping it real. So keeping it real, there is a lot of information out there that isn't correct, and unfortunately isn't necessarily coming from a place where even the people have the best interest of the people they are trying to inform. And so I think that's also really important. I'm lucky to be part of a network of people who are really empowered and really interested in talking to our community and wanting to ensure that people have all the facts. And
good.
I hope that people feel like they can come to us and talk to us about these things.
No, I to be honest, I've been on this journey talking to a number of professionals so far. And, when you feel like, did I say that last year?
Yeah.
But something that you said, and we want to appreciate the fact that this is new, it's a pandemic, and things change. And I think that's what flustered a lot of people, was the changing information, because they said, they changed the information this week, changed the information that week. And I don't know if you noticed that a lot of things came against, they keep on changing. So we're not comfortable with that. We're not happy with that. So people don't believe. I'm within faith groups and different types of faith groups and whatever. So you got some faith groups that, get your jab on. Let's do this, yeah. And then you got some faith groups where you feel like you're faithless or you're silly for even believing that COVID is real. And they mention that things like, is a question for you when they say that the coronavirus is just a common cold, or it's just the flu is a corona as well. So why are we getting tested for corona? And I'm like, I don't know. You know what I mean? I don't know why, but I said, see, it's just rubbish. It's just coronas and everything. They just called it something just to get us all scared. I don't know if you've heard that one before.
I mean, I've heard everything. I'm going to be honest. I don't think there's something I don't want to call them myth, but if there's like a question or a observation that people have made that that's been spoken about online or in general in the community that I haven't heard. I think one of the things I always say in relation to this, I mean, and the honest truth about a lot of this is it all comes back to trust. And, you know, as a community, we have many reasons not to trust people who we see in power, the people we see in certain situations, because historically and ongoing, they have proven to us that unfortunately, they're not looking out for our best interest.
Wow.
And that, unfortunately, is the case for many people within our community when they interact with certain services, certain people. I personally am quite lucky in that I don't feel like I have that same level of mistrust.
Yeah.
But I do understand where that level of mistrust comes from.
Come on.
And when there is a level of mistrust, there is an onus on the person who is not trusted, but also like both sides to an extent, to rebuild that trust and to rebuild that understanding. And that's what many of these conversations are about. They're about actually, when I tell you something, do you trust that what I say is authentic and is coming from a place where I actually care about you and I want the best for you? And the reality is that for many of us, especially those of us who look like you and I, that is the reality. And even for people who don't look like you and I, within healthcare, that is the reality. However, it needs to be an ongoing conversation. It needs to be an ongoing dialogue.
Dialogue, correct, yeah.
We need to build up a relationship where people feel like they can actually trust what is said.
Brilliant.
And they feel comfortable and they feel like they can go to their general practitioner or they can go to their local health service and feel like they're in safe hands. And I think it is happening. I hope it is happening. I know that it happens definitely when I interact with patients. I feel that I build trust with the patients whom I work with, but it may not be the case for everybody, and I'm fully aware of that as well. I mean, I could talk specifically about the things in relation to, you know, is this flu? Is this not flu? It's not flu. It's a different virus to flu.
It's all different makeup,
different way. It's not the first coronavirus that has been a significant severe virus. I think that's important. Because I'm an infectious disease doctor, I know about the other different types of coronaviruses and the severe ones that we've had in the past. Bear in mind, this is called SARS-CoV-2. Which means there was a SARS-CoV, as in the first one, and I know about that one.
Cool.
And there been MERS, which is the Middle Eastern respiratory virus, which has also been quite significant in the same way that SARS-CoV-2 is. So I think there's a lot of misinformation and a lot of people.
So know your stuff. Don't come on the table and says, guess what, this, and you to go, oh, is that where you come? I can go 20 years before that. And it's been around. Now, you mentioned about yourself and you're part of almost ensemble of people, you know, got Black Panther coming on and you can imagine you got the armies, the Wakanda armies and the stuff like that. So you're part of a crew nation, you know what I'm saying? She should laugh, you know, you imagine you've got certain tribes all coming together to fight, you know, I'm not saying, guys, I'm not spoiling Black Panther, by the way, I ain't got a clue where it's going, but you know, typical Black Panther, you'll be everybody coming together to beat up somebody anyway. But you're part of a Avengers group or Black Panther, Wakanda Forever crew nation, which is coming together for the Caribbean and African, you know, health network. Now, I'm noticing these organizations are kind of coming up with people like yourselves coming together. Explain to me what this is about, because sometimes we don't realize we've got a hotline. Now, is it a hotline every time we said, listen, the doctor give me too much paracetamol, you know, he's trying to kill me off? Is it that type of I'm sorry, I'm being wicked today here. Or is
so the first thing to say is the network is there not to substitute the work of your community provider or your GP, etc., but to act as kind of an information service, a way to help people navigate the system, a way to help people understand certain things, especially when it comes to things around COVID, around vaccination, helping people understand that maybe they might have long COVID. All of these things are things that can be discussed with members of our network via our phone number or our website. There are also a number of different webinars that the organization does, and there are a number of different ways in which you can contact people who look like you or I in order to get kind of information or just support really around health issues. And I think that's a really powerful resource. One of the things that we did do earlier this year actually is we collectively signed a pledge as about 100 Black health professionals in order to be there as public figures, as members of the community, as healthcare workers.
That's good.
In order to be able to inform people about COVID and about vaccination and to answer questions. So we know that people have questions, and justifiably people have questions. And sometimes they feel like they might feel like they perhaps can't get these answers from the general practitioners, or they can't get the time with whoever they would like to in order to discuss these things. And that's what we're there as a network to do. Most of us are on social media. We're quite active on social media.
Brilliant.
Or you can contact people via the website, or like you said, there is a number that you can call.
I'll definitely put it in the description as well. We're going to have the details and on there. So don't worry about that, sis. That's going to be all in there.
Okay, good. Yeah, and there are ways in which you can contact members of the network or people who are happy to have these conversations.
Wow.
I've had hundreds of these conversations now, I feel. I mean, maybe not hundreds of conversations, but definitely like dozens of conversations. I'd say hundreds of people, because many of them will be webinars, and many of them have been face-to-face conversations. I've had some really great face-to-face conversations with people where I've just explained what I know about COVID, what I know about vaccination, and help to lay some fears, I hope. And that's the most important thing.
Just what? No, absolutely fantastic. Now, just one little cheeky one. Who is it's not venomous, but you've got the Caribbean and African communities, yeah? They are, which is we all black, different approaches to healthcare. Which community is more stubborn when it comes to what you find more stubborn? She's laughing because she knows the answer. You know what I mean? I wouldn't say. I mean,
yes, we are a black community. We are a Caribbean community. We are an African community. Yeah. I would say, but we're not like a monolith, right? So yeah. I can't say that like, actually, I've had more opposition from people from the Caribbean community, or more opposition.
This is the future shadow healthcare secretary. She answered the question perfectly. Absolutely answered it perfectly.
But what I can say is, like I said, I feel like there's a common theme that underlines a lot of this. And as I said, I think it's a lot to do with trust and to do with previous experiences and lived experiences. And that's just the reality of it. Like I kept on having these conversations, and sometimes I would find that like the questions would be different. But it took me a while to actually come on to the fact that actually it wasn't so much like the nitty gritty of does the vaccine do this and what are the side effects. It was just more to do with the fact that, can I trust you? Can I trust that what you're saying to me is true? And do you care about my health? Are you trying to do something that is not good for me? I think, that's the reality of a lot of these conversations. I'm hoping that we're starting to gain the trust of people. 100%. I'm hoping that these conversations are helpful. Please, somebody tell me if they're not, because, I could be off doing other things.
No. It's awful, and it was almost, I mentioned to somebody as well, it's almost a perfect storm. You had the Black Lives Matter and the flagging of injustices against black people in a period when we're just about to start taking the vaccine, and then all of a sudden all the injustices all got put in our faces, and it said no one had said nothing sorry for this. And then you're gonna go, I tell you what, you take the vaccine. Let me know in 3 years if your arm ain't dropped off, or we've watched I Am Legend and we ain't turning to no zombie right about here, yeah? You take it and let us know, you guys need to move on. But we're still stuck here, you know what I mean? So you said that the mistrust is real, the mistrust is there. But again, our decision is based upon past hurts, when really and truly we might die because we haven't really got over that past hurt. So we got a lot of work to do within our communities, and that's not for people outside, that's for us to really get around the round table. And I really do appreciate yourself, and the NHS itself, and setting up these conversations. And this is not no covert thing, this is above board. So this shows that there's institutional approach to rectify this, and I definitely appreciate that. So sorry, I know I added one little cheeky one. That's fantastic before, yeah. I don't worry, this one's not as cheeky still, now is basically over the period everyone was sponsored by vitamin D when it came to black people, and I think vitamin D must have spiked in sales from our community. It's like every Holland and Barrett in our areas got sold out. All the pharmacies got sold out of vitamin D. Now I haven't seen in no paperwork any encouragement from you guys to say take vitamin D because we're all deficient. Personally, I play football outside, so I like to naturally be outside, go for walks in the morning in the sunshine, whether it's sunshine or whether it's raining or not raining. The sun's still out there, so I'm still trying to absorb vitamin D. But yeah, no one's mentioning vitamin D. Now, is that a myth?
So you come to somebody who's a convert of, not convert of vitamin D. So the reality is putting COVID aside, the majority of us are vitamin D deficient. And that's because of the weather in this country, because we don't get enough sunshine, because of the way our lifestyles. Most of us spend all day indoors. Think about your average person who goes, you're sitting in a dark studio. Think about your average person who goes to work in the morning. They might leave their house at like 7-8 o'clock in the morning, get into their office, be in the office all day, maybe go for lunch, but probably lunch in the office or lunch in the local canteen. We get very little sunlight, and most of us who have more melanin in our skin, obviously we're more protected from the sun, but also it means we get less sunlight. So what we tend to find is that around by about the time you get to spring, majority of people have very low vitamin D levels because they've gone through the winter where it's cold outside, where the days are shorter, etc. They have very little sunshine, and that can affect you. That can make you tired. That can make you cranky. There are things that can happen. So I am a big advocate of vitamin D.
Okay. Not directly with COVID, but
just as a whole.
As a whole, you encourage it. Yeah.
I mean, the research around whether or not it has a specific effect in COVID or other infections is ongoing, and I don't know that we'll have a definitive answer in relation to that anytime soon. Yeah. But I think just from a kind of general health point of view,
it's good for us.
Vitamin D supplementation is not a bad thing. Obviously, don't overdo it. Because people will just be like, oh, it's okay, I'll just go and sun myself for hours, and there are risks with sunning yourself for hours as well. So I think everything in moderation.
No, 100% get it. And on a more cheeky note, me being a bit lighter, does that mean I'm not as I'm kind of in between?
I don't know the exact science of that, but maybe. I mean, it's more just to do with our modern lifestyle, and especially our lifestyle with it.
Brilliant. Oh, right. That's cool. So,
in the same way that people are not as active as they used to be. So, a colleague of mine has a standing desk, which I think is a great thing. I think actually that
I might start doing that in the studio. I might raise up the table. Yeah, and start doing. Yeah.
I mean, I'm lucky in that the fact that my job means I do walk around the hospital, so I'm moving from that point of view. But the more things we can do to keep ourselves healthy, to eat the right things, to exercise the right way, to cut down our alcohol, all of these types of things are good things for us. I mean, I'm not going to say that I'm the perfect example of doing those things, but do as I say, not as I do. No, I'm joking. No,
you sound like our parents now.
It is something that I try and live by. I think it's quite important that we all try and think about our health in a more holistic way and do things that can improve it.
Yeah, no, 100%. And I think that it's a new wave. And if we had this knowledge when we were younger, our lives would be totally different, I believe, for a lot of us. We just never had the knowledge that we have now. And guys, please, this is amazing about these platforms that we are able to discuss about subjects that affect us day by day, and appreciate you keeping it with us, in a lot of areas. I know I teased out a few cheeky ones in there, but I thought I could get away with Dr. Sarah. She seemed cool, she seems cool. But no, really do appreciate your time and efforts, and even again appreciate the risks that you took in the COVID period, and I know that would have been a lot of cost on a lot of people's who was working in the NHS day by day, on their minds, on their body, and a massive toll on them. And we do definitely appreciate it, but we don't want to be that disrespectful community. After all the efforts, we're still at the same place as we were, and we're still fighting us. So we're not fighting against each other. We're here fighting for the best for our community, and that's why we're here, guys. To do that. So definitely on that note, really appreciate. I like to say, you know, when they say "doc," I appreciate it, doc. You know what I mean? No, absolutely. I learned a lot from today's conversation, and there's a lot of things to pull from, and definitely, again, we got organizations that we can communicate with who have got professionals in the NHS that are ready to talk to us, guys. And do check out the description, and that's the Caribbean and African Health Network. And say from an NHS staff in any part of the country, is it good for them to say, I want to help and support this? They can contact again.
I mean, and that's the thing. And I'm the other thing I want to say is, they're not the only organisation doing this.
100%.
Thankfully, there have been many organisations and many people who have taken it upon themselves to help and reach out to the community and try and make a difference. And I think that's a really important thing. For example, like I know Croydon BME Forum are doing quite good work down in South and across London in relation to just ensuring that the right information get out there. So there are various different organisations and healthcare workers who are just working to ensure that we get the right information out there and that we are actively and positively engaging with the community as a whole.
Thank you so much for your time, for having this conversation. And I know you're going to be probably doing another webinar next week or Zoom call every week. You just seem like that person that's ready for it and then loves doing it anyway. But listen, thank you for your time, Doctor.
Thank you for having me. Thank you.
No, appreciate it, man. Hopefully I wasn't too cheeky in my conversation, but
You're all good.
Thanks again, man. But listen, guys, take care. Listen, check out the description. Do see what information anyone you want to contact. Please, guys, do make your comments as well. We can respond to your comments as well. I can get back to Sarah and say, listen, this is what this person's saying, and we can debunk that. We can even raise another podcast based upon that conversation as well. So please. Guys, we all good here anyway. But thanks again for your time and efforts, and thanks again for the NHS for partnering with us to talk about these health, I wouldn't say issues, but health subjects that we need to talk about when it comes to our communities and the NHS. Blessings.
Thank you.
Thanks.
Hey, this is your bishop from Rock Solid. Thank you so much for watching us on YouTube. Thank you so much for clicking and subscribing and also sending these videos to other people as well. We are so hungry to get your support. So remember, check us out on our website, and also check us out on Insta and wherever you want to find us on Spotify. You can play us all day as well. And just make sure that you are supporting this channel, that we are developing our agenda towards music of Black origin, and that is gospel music with a message. So please walk with us on this journey. Bye now.